When you visited hospital for breathlessness or chest pain or after a bout of blackout, then your doctor recommends a series of medical tests, and you wait for the results. When results come and when you meet your doctor, he says that your heart is seriously affected, what that means. In this video we'll understand what are the various medical tests doctor recommends to know our heart health and what are their significances. Before that, please subscribe to my channel, press the bell icon and like and share the video. So, let's begin the video. To assess whether your heart is healthy, doctors use a combination of medical tests which includes functional assessments, blood tests, and imaging. Functional assessments are like blood pressure measurement, electrocardiogram, stress test, Holter monitor. Tilt table test. So, a blood pressure measurement is used to check if the patient is suffering from hypertension, as which is considered as a major heart disease risk. Secondly, the electrocardiogram. Electrocardiogram, or in short, we call it as an ECG or EKG, which is used to examine the electrical activity of our heart from which we can detect if there is any arrhythmias, heart attack, or any poor blood flow, etc. Thirdly, stress test. Stress test, or we also call it as exercise ECG, as it involves the exercising on a treadmill or a stationary bike to reach a target heart rate, or a medication-induced test if exercise isn't possible. The test concludes if you reach the target heart rate or experience symptoms like chest pain, shortness of breath, or dizziness, from which the doctor examines as how our heart is performing under exertion and, hence can able to detect the coronary artery disease and exercise tolerance. Fourthly, the Holter monitor. Holter monitor, which is nothing but the 24 to 48-hour ECG monitoring. This is used to monitor our heart continuously to detect if any irregular heart rhythms is there over time. Fifthly, tilt table test. Tilt table test involves monitoring of your blood pressure and heart rate while you lie on a motorized table that is then tilted upright. The test starts with baseline measurements while you are in flat position, then the table is tilted to an upright position for up to 45 minutes, while you remain still. Then medical staff observe for symptoms, like dizziness or fainting, and the test may involve giving medication to make the results more apt, and thereby doctor can be able to check the blood pressure response and can detect the syncope or fainting, and or autonomic dysfunctions, etc. Now, second type of medical examination doctor recommends is blood tests, under which he can recommend the following. Firstly, lipid profile. Lipid profile test is a single, comprehensive group blood test that measures multiple lipid levels in our blood, including total cholesterol, LDL, which is also called as bad cholesterol, and HDL, which is also called as a good cholesterol, and triglycerides. This test helps doctor to assess cardiovascular disease, in short CVD risk, by measuring cholesterol and triglyceride levels in the blood, whether they are in normal or abnormal ranges. Secondly, cardiac biomarkers. Cardiac biomarkers are substances like troponin, CKMB, and BNP. When they are released into the bloodstream, it means that the heart is damaged or under stress, and thereby they are used to diagnose heart conditions, like heart attacks or myocardial infarction, and help in monitor treatment, and predict a patient's prognosis. Similarly, the BNP and NT-proBNP test help in detecting the heart failure severity. Thirdly, thyroid function test. Thyroid function tests are done to rule out if the thyroid issues affecting heart rate or rhythm. Okay. The third type of medical examination which doctors recommend is imaging. What are the various types of imaging test which doctor can recommend to examine the heart health are? Number 1. Chest X-ray. Chest X-ray is just a basic imaging used to analyze the heart size, fluid in lungs, structural issues, etc. Number 2. Echocardiogram. Echocardiogram is an ultrasound imaging, which helps in analyzing the heart structure, valve function, heart pumping strength, etc. Number 3. Coronary calcium score. Coronary calcium score is a CT scan procedure, which helps in detecting if any plaque buildup in our coronary arteries. Number 4. Cardiac MRI or CT angiography. Cardiac MRI or CT angiography are the advanced imaging techniques that helps in study the detailed heart anatomy, blockages, scarring, etc. So these were the medical examination, which your doctor asks you to undergo to understand your heart health condition, and thereby recommend suitable medical interventions accordingly. Okay. Once again, make a note that when should you get tested. Firstly, if you have a chest pain, shortness of breath, dizziness, or when you experience fatigue very often, or tiredness even with small exertion, or, secondly, if you have a risk factors like high blood pressure, diabetes, smoking habit, or any family history of heart diseases. Thirdly, make sure to have a routine screening starting in your 20s, especially to know if your blood pressure is stable or abnormally deviating, and also to check if you have any abnormal cholesterol level in your body. These routine checkups are very essential, and are very first step to prevent any heart diseases. Be aware, be preventive and take necessary action timely. Don't risk your life. Hope the topic was helpful for you. If it was, please don't forget to like, share, and hit the subscribe button and drop your thoughts in comments section. Thank you.